we were trying to help a group really reduce the number of days that their claims were sitting in AR. Their days in AR were really, really far out. And when we started digging, their days in 120 plus were really high. And there were two competing factors. One was that they hadn't written anything off. So they had claims sitting in their aging that were in there for like 10 or 15 years. And at a certain point, things just need to come out of the system. You have to accept that revenue is not going to come in, and you got to get them out of there because it's improperly going to inflate your days in AR, right? So we helped them get that cleaned up. Another big issue that they had was that their payer database in their system was just bad. It was terrible. And I think that when they first set up their practice management system, when they first transitioned to it, whenever that was, they just started putting payers into the system. And it wasn't one of those systems that will automatically pull in the payer data for you. It was a lot of manual entry in their payer database, right? So they were typing in the carrier names and addresses, and then anybody who'd go to look one up wouldn't look for the same thing, right? So one person put in UHC, another person put in United Healthcare, somebody else put in United HC, and now you've got three for the same payer. But one might have a typo in the zip code, and one had a typo in the PO box. And so a lot of what they had sitting in their AR, it wasn't that the claims weren't going out the door with the correct information, it was that they were going to the wrong people. And so there was a lot when we ran this report of their AR and we really started digging into it. I said, you know what, I want to know for these payers, how many payers have their entire balance, 100% of their AR in 120 plus. And there was like 15 or 20 payers that were like that. And for all of them, we found duplicate, even triplicate payers in the system with the same name, same carrier code, but they just were not set up correctly. And I think another challenge for this particular group is for about 50% of their payers, they were submitting direct to payer and they weren't submitting them through a clearinghouse. Wow. So they had manual entry issues on the carrier database side on top of manual errors inherent to something not scrubbing for you. So it was quite a challenge. We did eventually get them all cleaned up and squared away, but it definitely took some time.